Now we'll start with the lecture. So welcome you all to Sail to MDS Dental Academy. Myself, Dr. Malit Vedi, I'm pediatric dentist and assistant professor in College of Dental Sciences. So friend, today the topic of interest, as I have told in the beginning, that to do MDS or not. Then hi Dr. Hemant. Then second, we'll talk about the importance of doing their short clinical courses, the prospects of government jobs, and on request of all my dear aspirants, we'll talk first about the Gulf countries opportunity. So dear friend, the Gulf country opportunity is good. Our degree, whichever whether it is a BDS or MDS, it is valid there. So around five state, or we can say the five countries are there in the Gulf area: Dubai, Sharjah, Abu Dhabi, Oman, and Saudi Arabia. So for all these five states, the exams are different. The exam pattern is different. So for example, you want to go to Dubai, the exam will be different. You want to go to Abu Dhabi, the exam is different. So first of all, I will tell about the which are type of exams are there. For Dubai, you need to give the exam known as DHA, that is DHA. For Sharjah, it is MOH. For Abu Dhabi, it is HUD, HAAD. For Saudi Arabia, it is SCFHS. For Oman, it is OMSB. So for every state, you require different exams. These exams are license kind of exams. And the one important thing is that whichever exam you give, the boon is that there is no negative marking. Of all these five exams, they ask around 70 questions. Only in Abu Dhabi exam, that is a HUD exam, 150 questions used to come. The exam pattern is little tough like our AIMS and NEET. They used to ask probably the reason-based and case-based scenario. So you have to be very, well versed with your clinical knowledge. The basic comes very little, that is around 20%. Then if you want to go as a BDS, the experience required is around 3 years, and MDS experience is required around 2 years. And this experience does not mean that you are giving the certificate from any of the clinic. The hospital, the clinic should be NABH accredited. The accredited hospital experience only they are counting. Fine. Then this exam, whichever exam you give, it is your license exam. It does not say that if you clear any of the license exam, you are bound to go and you will get the job. The job opportunities will be open there. In this Gulf countries, it is not like in India that wherever you wish, you can open your clinic or anybody you can hire. Here, the group of hospital will be there. So the hospital will put request to the government that they require 2 general dentists or 2 orthodontists. Based on that, the government will give them approval. The visa approval will give. Based on that, they will open their postings. They will open their requirements or their recruitments. So first you have to clear the license exam. After clearing that license exam, you will have a 3 to 4 months to go out there and search the job. And mind well, to search job is not that much easy. It requires a lot of work hard to go and search the job. Afterwards, the websites we will deal. You can go to the website known as prometric.com. In that you can go in search button and type any exam, like you want to know information about Saudi Commission, around Saudi Commission. All the information will be available there. Regarding the pattern, what all you have to study, when you go to the concerned website, they have told for the particular subject which book you have to read. Like for orthodontics, you have to read The Profit and Moss by Orthodontics. For pedo, they have mentioned McDonald and Pinkham. For endo, they have mentioned Grossman and the Engel. Like that, for particular subject, particular book is there. For practice, you can buy one book that is coming. Dr. Hossain book is there. It is an MCQ book practice. And one more book come of Dr. Mahalingam, Dento Gulf book. This book contains precise model papers which help you to understand how the papers exam will be there. Plus, in the beginning of these books, they also mentioned how to fill the form and everything. The biggest advantage of this exam is that you can give it anytime and at any place. In India, around 7 to 8 centers are there. And it is not like our USA exam that it will come within 6 months or like 3 months interval. You used to give this Saturday, you can fill the form and you can give the exam. So that was the synopsis, or you can say the gist of the Gulf countries. Fine. So you should know that where you want to go. Decide first in which state you want to go. Second comes the filling of the form. For that you can go to the website prometric.com. Information will be there. You fill the form. They will assess you. You should have the proper experience certificate as well as other documents will be there like your passport, then your internship completion certificate, recommendation letter. After that, you have to give the exam. You have to pass that exam. The percentage is around 60 to 70% minimum you have to clear. Based on that, you will get the license that you can practice in that particular area. After that, you have to search the job. You can use online portal, offline portal, both you can use for searching of the job, and then you can practice there. The fees for the consent exam is not that much. It is very minimal. Everything can be completed within 25 to 30,000. But once you get the job, the work is done. They will bear all your expenses. But mind well, dear friends, before 5 to 7 years, the scenario was different. What happened nowadays? They have their own dental graduates. So for general dentistry, they are hiring their own students. Yeah, for the master or specialty, they are hiring the student from the other place like India or from the other waste countries. So for BDS, the scope is little less there, and even they have decreased the salary aspects from BDS point of view. And also nowadays many specialists are going on from the India also, so they believe in hiring specialists only. So before thinking about this, Gulf countries think how the scenario is there. Not that much cool and calm. It is little dicey out there. Fine, but after MDS, here little scope is there. You can go and you can practice there. Salary is good, around 2.5 to 3 lakh per month you can earn. And also one more thing, job availability in country like Dubai, Sharjah is very less. Nowadays, most of the students are going to the Saudi Arabia and the Oman. There vacancy has been created. Fine. So that was all for the Gulf countries. If anybody want more detailed information, they can WhatsApp me. So now we'll come to our main topic, that is to do MDS or not. So dear friends, this is one of the biggest question or challenging question I say to answer my student. You know, many times college used to call us as a guest speaker to speak about this to importance of the MDS and not. So I have seen in many of the private colleges, the students are very reluctant to do MDS. You know, in that mind that to do MDS is wrong, or even sometime what happened when the lecture used to be there, they used to so much admit that they are not ready to sit in the class also. You know, after when we complete the internship, we have a pump of blood in us, something we have created like that. So they always feel that MDS is little downgrade or inferior. So why it happens? Why many of the students, even some of you are watching, they also might be feeling that to do MDS is wrong thing, because of two main reasons. The first reason is that the negative impact of your seniors. What happened that we used to be in contact with our immediate senior for the 4 years. We asked them a lot of things. For practical we asked them, for the theory we asked them. So we have impact of them. So sometimes what happens, the negative impact come. Mostly in private colleges, we have a negative impact of the senior. They only will feed in your mind that to do MDS is completely wrong. So this is one of the biggest reasons that people are thinking that MDS is very bad. Second comes the your college scenario. Sometimes what happens when we are studying in particular UG college and it is not that much good, or you are seeing the condition of the MDS is not that much proper, then what happens? We think that yaar kyun MDS karna? Why go more in the pit hole? But remember, dear friend, as your college scenario is there, all colleges are not like that. You have to upgrade yourself. When you meet few people outside, when you go outside and talk to few people, you will understand that how much competition is there and how much well-versed people are practicing. At that time, you realize that you are at nowhere. So at that time only we realize that yes, MDS is good thing. And whenever you are in particular college, for example, you are in particular private college, upgrade yourself to good private college or good government college. If you are in good government college, upgrade to the top 5 government college or the AIMS college. So whenever or wherever you are there, if you work hard, you will upgrade yourself. So these are the two big reasons the students have in their mind that they don't want to do MDS. That is the effect of the seniors, and second, seeing their present college condition. Fine. So we'll talk one by one. Whatever points I'm talking, they are my experience which I got from my students when I meet them. So students most often ask me that, sir, what is the earning of this MDS. Remember, dear friends, in MDS, as your experience will increase, the earning is going to increase. Fine. Likewise, for example, you have completed your MDS today. It does not mean that you will earn in lakhs. But as time passes, as 6 months, 1 year will go, your consultations will increase, your clinic practice will increase, and you will at one level within no time. So remember, in MDS, as experience will increase, the earning has to be increased. This is the first thing. Second thing, people are telling that MDS has no value. This is completely wrong. And why it is there? Before 5 years, the MDS seats were very less. When we were there, we have to be in top 100 or 150 to get in the MDS. But nowadays, the scenario is completely different. A lot of seats are there. Because of this increase in number of seats, the mixed thing has occurred. There are good MDS also and there are bad MDS also. But you have to focus on the good MDS. Sometimes I tell to my students when they are studying some not good private colleges or they are not studying properly, they are becoming the modified BDS. They are not becoming the perfect MDS. So dear friend, MDS has value if you are doing from some good college and in proper way. Yeah, if you do some college which are not that much good, then it has no value. So you have to create the value for yourself. Then come to the third thing, that is MDS scenarios. Most of the time what happened, previously we used to do MDS for the academic job, but nowadays the academic job has no importance. Previously what used to happen that people are not aware of the specialty. Like for example, you take the endo. People are not aware that yes, endo specialty exists. Before 5 years, we hardly used to do that much implant, lasers, and all that. But nowadays, people are doing that. That's why specialty has come into boom, has come into surge. So the scenario has been changed. Now, EMDS has been completely focused, or completely our focus has changed from academics to the clinics. That's why in a present condition, the MDS is always at a very high level. Fine, dear friends. So hope I am not boring you all and you are getting to the topics, what I'm trying to say. The three things I have told: experience directly proportional to your earnings, MDS has value, depending you have to create, and third thing, the present scenario of the MDS. Now, before going to 4 point, let's have some small story which I like to tell my students. Once one old man was there, around 60, 70 years. He was not well from few days, so he went to hospital. So the doctors diagnosed that he is suffering from some carcinoma, and they told that now you cannot live more than half or 2 months. So that person became very sad. When he came back to the home, so he was very unhappy. And when we have nothing to do, what we used to do? We used to search here and there. So he starts searching his own home. He started to digging his field and everything he was doing. And luckily he found tons of gold in his own house only. At that time he became very sad. Oh shit, what has happened? And I'm staying in this house from last 25 to 30 years. I have gold of around crore to 2 crore rupees, but I'm only not knowing. So friend, that thing happened with us also. Inside us we have a lot of knowledge, we have a lot of capabilities is there, but sometimes we are not able to know our capabilities. We always try to underestimate ourselves. So please don't underestimate yourself. Fine. Remember, you have gold inside yourself. So keep on working in the right path. And just Dr. Vinay has asked me that, sir, earning is better in academic or clinic field? See, dear friend, at any time in clinic, earning is better. If you are upgraded in clinic, you can earn more and more. Fine. For example, if you do the MDS, if you go to college no academics, hardly will get 35 to 40,000. But now imagine you are a good implantologist, you are a good endodontist. In a day, you can do 10 root canals and you can earn 50,000 rupees. So that's a change occurs in the present MDS scenario. Nice question, Dr. Vinay. Thank you, Dr. Shiny. So that was a 3 point. Now one big point. Many of students and many of your senior will tell, take a gap of 1 year to go get into MDS. That is worst thing. That is the worst thing you are doing with your life. When you're in the internship, you are freshen up with the lot of knowledge of your final year. So that knowledge you can use for your preparation. And when you are internship, you go to college, you meet your friends, so you will be freshen up. You will have proper timetable. Now you can look in this quarantine lockdown period. What is there? We don't have proper timetable. So we go here and there. There is no much proper sequence occurring in day to day. But when you are in the internship, the proper timetable is there. You are going to college, you are doing patients, you are meeting your friends. So a sequence will be maintained in a day. So you can properly prepare for your MDS preparation. Imagine somebody is taking gap of 1 year. Don't dishearten, dear friends. Keep on working hard. Now, example, I just want to say, if you are taking gap of 1 year, you are staying at home, the pressure, the extra burden will be there from your parents, from your neighbors. You will feel agitated from the inside that what to do. I am now doctor and I am just sitting at home. That pressure will be altogether different. You know, uh, when my internship over around October, I'm not gone to home only. In Jan, we have the exam. Just I'm talking before 10 years. So 3 months I stayed in the college only, hostel, and I prepared for my exam. So that much pressure was there when the internship complete on me, that what will happen if I will not get MDS. So that feeling is always painful for us. So if any intern is hearing, please, dear student, don't take gap of 1 year. You can crack in internship also. Fine. Yes, Dr. Vinay, I will deal in later that how to maintain schedule and everything. Definitely. Now, people are telling, sir, we don't have money. How we will do MDS? Dear friends, who are you telling to take those NRI and management seats? Who are you telling to spend those 25, 30 lakh? You have 1 year. Why can't you work hard and you can go in that government colleges? It is not tough to get in government college. Around 300 to 400 seats are there. So easily you can get in government college. The thing is that you have to work hard. If you get in government college, the first month only you will get a stipend of around 40 to 50,000. The second year the stipend will increase and so on. So if you work hard properly, the next year only you will start earning money. Plus the good college you will be there. So MDS is never costly to do unless and until you make it. Then comes MDS only for clinics. I have told yes, with along with clinics you can do a lot of things in MDS. You can go to abroad also, like Gulf country is always open. Malaysia, Maldives, Myanmar, all South Asian countries, our MDS degree is valid. And even if you want to go to USA, UK, Australia, Canada, first in that initial assessment, they are giving more preference to MDS people. Because when you do the MDS, you attend conferences, you have extra degree, so you automatically your points will be add up. Fine. So these are 7 points are there, which I always tell to my student, and hope you maybe understand that why MDS is there and what all negative thoughts in their mind. I hope I have clear with these things. Now, some of the students get trapped in something. What is that trap? You know what happened when internship, people used to join some staff clinic or they join some trust. Dear friend, you are giving 2 to 3 years in that trust, or you are giving 1 and 1.5 year in joining that clinic. Instead of that, why don't you work hard in a proper manner? It is not like that the topper of the class only can crack the NEET MDS. Anybody who work hard can crack. I have seen my student who have got 55-60% in that final year, they have got top 100 in the NEET. So it's not tough to create NEET MDS. Your focus should be proper. So that was all big points regarding to do MDS or not. You all can decide. Now come to the fourth option, that is leaving the dentistry and going to other field. Like I've seen many of my batchmates and many of my juniors, they have left the dentistry and they have gone to other field like MBA, MPH and all that. So dear friends, remember they are short-term gain. Now you are doing the MDA, immediately you will earn 40 to 50,000. But that money will not exponentially increase after 3 to 5 years. But if you are sticking to your field, if you are doing MDS, first 1-2 years you may not earn big amount, but after 5 to 10 years your money will exponentially rise. That is for sure. You can ask any clinician, your money will be exponentially rise. So never go for those short-term gain. Yes, if you are not liking dentistry, 1% also, then you can leave dentistry and then go for MB or MBH. But if you are liking dentistry, work hard for it and try to strive for the best thing. Then one more thing, government jobs. You know, the college which I am associated, when I ask the student tell me, sir, I want government job. Dear friends, everybody wants government job, but this government job cannot be your goal. It is an option. You see, take out any government job. It is not like NEET exam that will come in second week of December, or like AIMS exam coming first week of December. This government job can come anytime, mostly once in a 2 years or once in 3 years. And even the recruitment are also not completely trustworthy. I was associated with the RPSC exam, GPSC exam, yet few recruitments have not done. So you cannot consider government job as an your ultimate goal. You can keep that government job as an option. You keep on working. If the opening come, I will give the exam and I will clear up. But you cannot rely completely on those government job. You can keep it as an option, as a back option, that if advertisement or openings will come, I will go for the exam. If I clear, I will join the government job. But it is an option. It is not ultimate goal like your clinic opening, abroad dentistry, or MDS. Keep in mind. Then the biggest thing want to talk is the clinical courses you people are doing. Now, dear friends, one thing you remember, this clinical course are not bad thing, but they are not ultimate thing also. You know, in dentistry, only two degrees are valid, that is BDS and MDS. Now, I have seen many of my friends and many of people are conducting the courses. They are giving fellowship courses. Now, for example, in my clinic, 100 patients are coming. I am training few students. That is very good. I should train and people should take knowledge from me also. But that is not your valid degree. I have seen many of the interns not attending college and spending 1 lakh to 2 lakh rupees in joining those internship courses. Dear friend, remember dentistry, when you are doing patient, whenever you are in clinic alone, it is defined by three things. That is diagnosis, treatment, and prognosis. When you do such small, short courses, you will only learn few aspects of diagnosis and treatment. You will not learn the prognosis. Like for example, today a patient has come with an abscess to me, a pedo patient, for example, I'm doing pedo practice only. So I have seen in my three college, I have seen the prognosis in my three college. I know that if I do pulpectomy, I can save the tooth. But if you are doing this short-term courses, you will not get complete knowledge. Instead of that, you can do the MDS. Yeah, it will take more time, but complete knowledge will be there with you. These courses are good, not bad. Even I am also conducting and attending few of the courses. These courses are for the upgradation. If you want to upgrade yourself in your life, these courses are boon to yourself. Like for example, I am practicing from 5 to 6 years. I want to learn the implant. I have joined the implant courses. Now what happened? I am doing the patient from 5 years. I have seen the many edentulous cases. I have given the FPD. Now, if I am doing the implant courses, I have little bit idea, so I can put all those knowledge in the practice. I hope you have understand. One more example I will give you. Two of my friends were there. One of my friend was working in the orthodontic clinic, and another friend was in his own practice. So both of them have decided to do the ortho courses. So you know what was the result? One of my friend who was working in his independent clinic was not getting any ortho patient. So he has done 6 months ortho courses, but now also he was not able to do any ortho cases. But another my friend who was working in the orthodontic clinic, so he was getting patient every day ortho. He was seeing ortho patient every day. So he was not able to practice. So whenever you are doing these short clinical courses, the practice is mandatory. Somebody should be there on you to guide whether you are there, whether you are going wrong or right. So the best way to get knowledge is rather to do the MDS rather than wasting your time in doing the short clinical courses. You can do anytime, it is best, but for the upgradation. They are good for the upgradation, but not as a diploma or the degree purpose. Because in dentistry only BDS and MDS is valid, and government assigned diploma like they are diploma in endo and diploma in ortho. So please, before joining such internship courses and spending your parents 1 lakh to 2 lakh rupees, keep in mind that you can do more and more better than that. Fine, dear friends. So I hope I have covered whatever topics I want to cover today. Just want to end my lecture with one more short story. I hope everybody have read the book of Compound Effect by Darren Hardy, one of my favorite book. If somebody is from the colleges which I have taken the lecture, they know I have told them this lecture also. Now imagine there are two persons. To one person, immediately somebody have given him the 30 lakh rupees. And the another person, has given the option that you will not get immediately 30 lakh, but every day you will get 1 rupees, which will be multiplied, and at the end of 31 days you will get the amount. So there are two options, that immediately you are getting 30 lakhs, and second option, every day the money will be multiplied till 31 days. Now what will happen, dear friends? On day 5, that person who will take the immediate money will have 30 lakhs, but the another person will have around 16 rupees. After 20 days, that person will have 5,000 rupees, and that person who has taken immediately money, he or she has 30 lakh. So people will tell those person that what the biggest blunder you have done. That person has immediately got fame, he is having 30 lakh rupees and you having just 5,000 rupees. But wait for that. After 29 days, that person will be having 30 lakh rupees only, but the another person will have 27 lakh. Now the magic will occur. On 31st day, the another person who told that I will wait for 31 days will have around 10 crore rupees. So that is the story of your life, dear friend. If you will not have patience, if you want the immediate gain, immediate profit, the profit will be there, but short term, like that 30 lakh rupees. But if you will wait, if you will work hard, the profit will be like that 10 crore rupees. So you people have to decide what you want in your life. Whether you want that immediate gain, immediate money, or you want to work hard, you want to upgrade yourself, and you want to be the very good dental surgeon, and you want to shine up your life. So all depends everything on you. So that was all for the today's lecture. I hope I have told everything. Any doubts to that, you can tell me in the chat box. It's open for another 10 minutes. Yes, Dr. Damini, you are asking me which branch is best according to current scenario. See, nothing like that. People are telling that yes, currently the ortho is good, OS is good. It depends on your interest. I have made one video on that. It is information is given in the description box, that are you confused about your branch selection for MDS? Remember, even if you are like oral pathology, you are taking oral pathology, create the extravagance in that field and you will rise. You can watch that video. In that I have explained detail for each and every branches, what is the scope right now and what will be the scope after 5 years also. In that video I have explained everything. And remember, there is a no concept like non-clinical branches. In our dentistry, it is clinical branch and semi-clinical branch. So, dear aspirants, you are open. You can ask me any doubts in the chat box. Yes, Dr. Vinay, you have asked me that how to prepare in this hectic schedule. We'll have another live session and strategy for NEET MDS, but I will tell you in short that, dear friends, I believe in pyramid of NEET MDS preparation. What the pyramid means? The base is your synopsis, middle part is your MCQ, and then come your revision part. So if you are in the internship or if you are working in the clinic, you can be the 5 a.m. club. Wake up in 5 a.m. morning 5 to 7:30, 2 to 2.5 hours, read the synopsis, read the textbook. In college time or in clinic, practice MCQ. Fine. And whatever MCQ doubts you have, you can come back to the home and you can revise them. You can read from their explanation or you can read from the textbook. So in this way, you can manage your timetable. That is the pyramid of NEET MDS preparation. We will deal in detail each and everything in the next lecture regarding NEET MDS preparation, when, how, and in which manner to prepare. No, Dr. Vinay, there is no necessary to read the whole textbook. I always use the word refer the textbook. You cannot read the full textbook. You have to refer the textbook. Now, for example, in a day, I am doing 10 MCQs and I have doubt in 4 to 5 MCQ. I will read the explanation part. After reading the explanation part, I am not satisfied. Then I will go to the standard reference book. So in this manner, you have to complete the circle. Nobody can read the full textbook. You have to refer the textbook at proper steps. And which book to read, that is also information is in the description box. You can click on the link, that books for NEET MDS preparation. Yes, diagram portion, it's very simple to master. open the standard books, you have to revise at least 3 to 4 times, read the diagram and read the description below. You know, in this time NEET 2020, 10 to 12 questions where they are prepared directly from the transcript written below the diagram. So just you have to keep on referring those diagram. Or you can, one thing you can do, for example, you are reading about the instruments of endo, go back to the Grossman or the Engel and you can check out the diagrams. That will help you to remember also, like reciprocal reading you can say, that you can do it. Yes, Dr. Damini, you are asking some question. You have halfly written. So friends, you can ask me any question regarding abroad dentistry, clinic opening, MDS or not, short clinical courses, government jobs, all the 5 things you can ask me anything. The coming NEET exam, mostly it will be in this second week of NEET. I don't think that they will postpone because time is there. So mostly it will be in second week of December only. For that, you see such type of questions come that 2 options are right. At that time, you have to bank on the most correct option. Like if I give the example, it mostly in physio or in value based, it will come that, for example, some value are there. If you are well versed with some of the good books, you can know that which is the more correct option. Like yesterday, one student have messaged me, sir, how the peristalsis movement can occur. It can occur because of contraction relaxation. The another reason are that it can occur because of the distension, mechanical distension also. But the more apt answer is your contraction, relaxation of muscle. So you should know that sequence, how it is happening. Then you can write easily this multiple correct answer. No, Dr. Damini, you cannot fill the form for NEET now. It will come mostly 1 month, 1.5 months before exam. Dr. Nikhil, how can find the job after cracking Gulf exam? That is tough thing. You can go to the online portals are there, like Govt.jobs. You can search in the Google. One portal is there, and also sometime what happened, we used to uh, associate with some agency, mostly in Kerala, Delhi, and Mumbai. Some agency are there which help in the recruitment. But take my word, take care of yourself. Don't give more money to those agents. Rely on yourself. You can apply online also, and if possible, you can go there if somebody is there, and you can apply in their hospital also. Yeah, Dr. Veena, you have discussed. So any other question, dear friend, we'll wait for more 5 minutes. After that, we'll wind up. Any other doubts, you can ask me. Right now, complimentary revision series is going on. If anybody want to attend the lectures, it's completely free till May 3. You can join. Yes, Dr. Hemant, in Nepal exam, you face 2 options, same like a 30% and C 30%. That time, how I select, sir? I not able to understand your question, Dr. Hemant. If both option are same, you can select either one. It's not like that. If some variation is there like 30 or 25 or 28, that is different thing. But same 30 is there, then it may be the mistake in paper. Like in our recent GPSC exam, 2-3 questions there given the similar thing. Yes, Dr. Shiny, for Gulf, only in the Abu Dhabi, you have to, practical exams are not there. You have to give the written exam from the India, but only in Abu Dhabi, after clearing the written exam also, you have to go there and you have to give the oral exams. Otherwise, such practical exam is not there. In Surat, Dr. Damini, I don't guess anything is there, but I'm in Ahmedabad. You can offline course in Ahmedabad also, and you can join my online course also, in which we will have the WhatsApp based lecture, which you can access anytime, anywhere. We have online lectures, where YouTube live intersection is there. So you can join our sale to MDS Dental Academy also, offline or online, anyway, which you find. Yes, Dr. Sagar, even if you're not serious during your BDS preparation, If you see, yeah, you have to work 10% higher than those students, but it is not like impossible. If you work hard properly, you can crack NEET. You can be in the top 100 of the NEET. So it is not tough thing. So don't worry. Surgery portion, Dr. Vinay, you can first read out your synopsis, read from the pulse from the dentist. Then for you refer once Nilima Malik and Kilian K. Beautiful diagrams are there, beautiful charts are there. Once you can see them, that will sum up your preparation. And when you are preparing for oral surgery, at the same time prepare for general surgery also. That will help you to remember many of the concepts. No, Dr. Kavita, just dental pulse, just dentist is not at all enough. As I have mentioned in my many of the videos that nowadays the exam pattern is changed. It's not like 5 years before. You have different types of question. You have a single based answer, you have a case based scenario, extended matching question, match the following, image based, all different type of questions are occurring. You can use pulse and dentist as a base, but at the same time you have to keep on referring the textbooks for particular things. So only pulse will not help you. Yes, Dr. Saru, sure, we will guide you. You can message me. My WhatsApp number is there. You can mail me in the description box. We'll add you to the group. We are coming with one more lecture regarding the strategy for NEET MDS preparation that can be helpful to all of you. It's all about self-belief, dear friends. Once you think that you want to do means you can. Thank you, Dr. Shiny, for your nice words. So friends, now 3 minutes are there. After that, I have to close up the thing. Any other doubts, you can answer me. Dr. Radha, there is no such sequence of referring things. It depends on you. Imagine you are feeling that oral pathology is tough, endo is tough for you. Start with the tough subject. Okay? Try to interrelate your subject. Like for example, you are taking physiology. Try to study physiology, pharmacology, and medicine all together. Study, if you are studying prosthodontics, study with dental materials. Like that, you have to combine yourself. If you are studying oral pathology, club it with general pathology. So it is not like that you can start with any subject which you like. For example, when I was doing my NEET preparation, I started my study with the help of oral pathology. In my academy also, I start with the endodontics nowadays, endodontics followed by cons. So it depends on the scenario, you can start anywhere. Thing is that you have to keep on going. Initial date will be difficult for you to study, but as time will pass, the repo will come and you can go for that. Yes, Dr. Vinay, Neeraj Wadhwan, AIMS 25, Target books, they are good books for the reference of question. In them also many mistakes are there. In Neeraj Wadhwan also, I respect Dr. Neeraj, he is one of my friend. In that book also there are few mistakes. In AIMS 25 Target MDs, few mistakes are there. But these books are authenticate for the questions. You will get the idea of the questions. So whenever you are studying them, take in note that whether the answer is correct or not. Refer textbook along with them. That will be helpful for you. But yes, these books are must you should have for the good reference of question papers. Dr. Kavita, weightage for each and every subject is same. From every subject, around 13 to 14 questions will come. You can check out the NEET guidelines. It is clearly written there. And this time also, the paper was very well balanced. Every subject, 13 to 14 question is bound to come. Definitely they will come. So you cannot leave any subject or you cannot consider that this subject I will not study. You have to focus on each and every subject. More 2 minutes left, dear friends. Any other doubt you can ask me. Yes, see, if you are reading Dental Pulse or a Gauri Shankar, either you can take, both are almost same. Both you study, then well and good. You select one, is good. Gauri Shankar is good where you can see the question along with the explanation. It's very nice book. Mainly the latest edition has decreased many of the flaws. So it's good book. You can refer that. But please, textbook reading is necessary. Textbook reference is mandatory. If you want to be in the top 500, if you want to be in those 1,000, 1,500, 2,000, then okay. But Want to be in good college? Please read textbook. That will be helpful for you. Have good concepts. Don't mug up the question. You can mug up 1,000 MCQ, but those 1,000 MCQ is not going to come in exam. But imagine if you are knowing the 1,000 concepts. From that, I can make lakhs of MCQs. So that's the difference between concepts and MCQ. 1.5 minutes left, dear friends. So we'll wind up the things. Any other doubts you can ask me. And I'm thankful to all of you, all the members out there that you came and attended the lecture. It's very nice to interact with the students. For AIMS, dear friend, Schaefer you can refer. But for few chapter like dermatological disease, for infections, you have to read the Naval. And for image-based question. For these three things, Naval is mandatory. As well as you can read the appendix given the last 20 pages of your Naval. It is very helpful for the sequence-based question and for few tricky question like radiolucency or radiopacity for good science. It is very good. Please refer those last 20 pages of the Naval also. And for histopathological picture, it is one of the good book. And particularly 3 chapter dermatology infections are given beautiful in that. Yes, Dr. Navi, it will be more than enough. But along with that, there are a few added chapters are there, like for endodontic surgery. Once you have to open up the Cohen and you have to see like perio, the surgical part of periodontics, at least once or twice you have to read from the Karanza. So there are few topics are there, which I used to tell my student with every subject. Like for example, if I'm like my old batch is going on. So last week we have dealing with the anatomy. So I will tell them to open up grace just for the facial nerve and the trigeminal nerve. So there are few topics which you have to study from particular things. The dentist and dental pulse and textbook reference will be okay, but few things you have to read from the textbook. Not much, say 5 to 7%. I'm sorry, dear friends, Manipal surgery you can read, but for general surgery, the best book is your Das. Maximum question comes from Das. Recently, the question was there for that after burn, what you have to select, dextrose or like that. So the answer was from the Das only. It is given different in the Manipal manual book. So please refer the Das, and it is very good book. It looks voluminous, but very easy to understand and remember. It's like story once you can go through it. So friend, now just 1 minute is left. After that I will wind up with the lecture. Thank you all for coming. Nice to see all of you. For oral surgery, Nilima Malik is very good. Balaji, not that much. You can it will be good for the chapter like sterilization is good in Balaji. You can once refer, but if you study Nilima Malik 4th edition, I hope it is more than enough. And for fracture, Kilienke. Other than these 2 books are more. Don't, and sometimes students are making mistake that they club many books. You have a collections of book. You should know for a particular subject, particular book you should have. Don't have a collections of book. For LA anytime, Malamed is good. Monims is good, but there are a lot of shortcuts in Monims. If you study Malamed, it is more than enough. Especially the initial chapters are good and it will be more than enough for you. Dr. Rahul, after MDS, you require 2 years experience to apply for DHA. PhD degree is not valid abroad. Yeah, for research purpose you can go, but for job purpose it's not that much. Previous entrance paper, there are no specific site, dear aspirant Dr. Radha. You have to buy textbooks only, because, and if some site are there, please take care that many of the questions are wrong in that. Even in your basic clinical MCQ book, I'm not defaming them. There are a lot of questions repeated and they have been framed wrong. So all that things you have to take care whenever you are referring books. See, for academic purpose, if you want to go, the PhD is important. Like, this one thing I want to tell you, that after MDS, if you want to want Gulf country in their colleges, the PhD degree will increase your chances of selection. Many of my friends are there. They have done the PhD and their chances of selection has increased after doing PhD in Gulf countries, mainly in Gulf countries. So that was all for today, friends. Thank you all for coming. Please take care of yourself. See you tomorrow with the WhatsApp lectures on the periodontics part 1. Till then, take care. Any other doubt, my information is there in the description box, and other also valuable links are there. You can go and watch it. Till then, take care.